2025 Early Connections Conference Expression, presented by the Van Slown Foundation. Early Connections Conference logo. Behavior and Big Feelings, Understanding Behaviors, Emotions, and Approaches to Regulation.
Hey everyone, thanks for coming. I'm sure for some of you it's been a really long day, so we appreciate you being here for our last session. So we're going to be talking about behavior and big feelings. So really like kind of understanding behaviors, the relationship with emotions, and approaches to regulation. Maybe. We might talk about it. There we go. Okay, so who are we? I am Alina. I use she, they pronouns. I am a relatively short white human with a very short brown haircut, wearing a compassion over compliance shirt under a black blazer. I have worked at Perkins in various capacities. I started as a residential teaching assistant in 2016. I'm really feeling old these days, and am now a behavior analyst in the lower school program. I have been working in special education or involved as a volunteer in some way, shape, or form my whole life. I am also an autistic parent of a neurodivergent preschooler. Things in our house get a little bit fun, very sensory. We got all the swings. And I really focus, especially as a behavior analyst, working with multiply disabled kids, to utilize best practices from various fields, not just mine, with a really strong emphasis on neurodiversity affirming practices, self-advocacy, and autonomy.
Hi, everyone. My name is Molly Bennett. I am an occupational therapist. My pronouns are she, her. And in my image on the slide, I am wearing kind of just a dark floral shirt. I have long wavy hair and I'm wearing gold glasses. My hair is shorter now for those who are seeing this in person. Just so you know. Thank you again, just like Alina said, for sticking around and coming to our presentation at the end of the day. It really means a lot to us. We'll try and keep it, interesting and whatnot for you guys. So I also am a neurodivergent woman, and I only became aware of my own needs later in life as an adult. So personally, my experience with developing regulation skills and all of that was a little bit later. So, I kind of made do as a kid and as a teen and as a young adult. And then into my 30s is when I started to kind of figure out what actually worked for me and what my actual needs were. So that was really empowering to kind of have that experience. And I think we'll echo a lot of that today. And so given that, it really brings me a ton of joy to be able to work with students here at Perkins and kids elsewhere, to help them with their self-regulation journeys and with their co-regulation journeys, because I think it's super important. And personally, I always learn something new in the process as well. So next up, what we're going to cover today. So first, we have a graphic on the left side of the screen. We've got some different emoji faces that are kind of in a semicircle around a brain, and the brain is split in two different colors. And so for us, what this kind of signifies is just what a spectrum, emotions, and regulation are, and how our whole brain and whole body are really integrated there in responding to all of this. So first, we'll talk about what behavior is, then we'll talk about what regulation is, some internal functions of behavior, some external functions of behavior. We'll talk a little bit about behavior and how emotions play around there as well, talking about understanding those needs and advocating for needs. We'll talk a little about what's next for you as a caregiver or educator, and then we'll share some resources at the end.
So behavior matters, right? I think a lot of the times we think about behavior as those like kind of external misbehaviors, right? But there's so much more to it. Behavior is everything we do. It's what we say, it's what we think, it's what we feel, it's internal, it's external. In this presentation, when we refer to like behavior in general, we are going to specifically kind of talk about those related to physical and emotional health and safety. So we may refer to it in carrying various connotations. It really can be everything from hitting and throwing, self-biting, crying, laughing, etc. when we think about those external behaviors, but they may not always match what our kids are feeling, especially for kids with vision impairments or other disabilities that may impact how they are learning and what they are learning, right? If we're not used to seeing certain facial expressions as it relates to behavior, et cetera, that might impact how we exhibit our behaviors. A lot of times there is an emphasis on changing and supporting external behaviors, and there's not always really that emphasis or understanding about how it relates to emotion. I know you think that that's a really big piece to remind people of. These emotions can be the cause of a behavior or the result. So for example, if I'm frustrated, I might stomp my feet. Frustration results in me stomping my feet. But if I swipe something or drop something and it breaks, then that emotion is going to be a result of that behavior. I dropped the thing, I broke it, and now I'm upset, I'm crying. We can't look at one in isolation from the other. Behavior, feelings, they are so integrated. The good news is this doesn't have to be all on one person. It really takes a whole team to look at behavior, to look at feelings, to look at communication. We're talking to the speech language pathologist, the occupational therapist, the behavior analyst, the school counselors, et cetera, especially because a lot of behavior is really best supported through multidisciplinary collaboration, carryover, and consistency. So some terms that some of you may have heard or may hear in the future. In the world of education and home services, there are some terms that are often used both in the applied behavior analysis setting when we're talking about behavior services and in special education and that world in general. Many professionals often refer to functions of behavior. This is one of my favorite and least favorite things because it gives you the why of the behavior. It's really considered what the child may be accessing or getting out of the behavior. But it doesn't necessarily mean the child is intentionally behaving to get that thing, right? Reinforcement is not necessarily intent. And I think that's important to understand. These functions are often boiled down to attention, tangible, escape, or automatic. And we'll talk more about what those mean. A lot of times when, especially BCBAs, some school psychologists and teachers also will conduct functional behavior assessments. They're typically looking at single functions of behaviors to tailor interventions to those presumed functions. But research is really starting to show that functions of behavior don't occur in isolation. There are, you might hear the term synthesized functions. It basically means multiple things are happening at once. We're escaping to our favorite things. We're getting a certain kind of attention paired with our favorite toys that we like to play with other people with, and those kind of things. Quotey quote. This is one of my favorite quotes. This is by Greg Hanley. He is a BCBA doctorate who's really pushing for more neurodiversity affirming practices within ABA and moving in the direction of, kind of what the autistic community and other disabled people are saying we should be looking at when we're talking about behavior interventions. We want to do what we want to do with the people we want to do it in a way we want to do it. We're not doing anything in isolation, right? What I want to leave work on a busy day to hang out with my friends at a bar, right? Or like Target or whatever it is. That's really like kind of what it boils down to. Either way, we're still going to talk about core functions of behavior because they do still you still can explain behavior through these components. So we're going to talk about internally driven functions, which is automatic. So when we talk about automatic, it's usually not reinforced by social or external factors. It includes sensory, pain attenuation, and other physiological elements, maintains homeostasis, and it must be considered in behavior interventions. We can't just look at the outside world when we're experiencing so much internally. And then externally driven, attention, what kind of attention are we getting? Escape, to avoid or to get away from something. And then tangible, to get or keep an activity or item. So
Obviously, there's a lot of different types of behavior that we might be managing, that we might be encountering, both in the classroom, in the hallways, at home, whatever it might be. And so, of course, we can't just attack everything all at once. We can't manage everything and help every, kind of outcome at once. So we have to prioritize. We have to prioritize the behaviors that we're going to work with. We have to prioritize what we're going to do in that moment. So in talking about behaviors, we try to boil it down to 3 priorities. So first up is physical safety. So this is the priority when behaviors are unsafe, and they may be unsafe for the child. It might be unsafe for other peers in their environment. It might be unsafe for a caregiver or teacher. So the first thing to do is make sure that the child is in a safe place and create safety around them. So, moving any furniture if necessary, moving any, toys or things that they might reach for to throw, or, whatever it might be. If they have a sibling or something like that, getting them out of the room and just giving that child some space. Then comes their emotional safety. So this comes along with that space and kind of giving them that time to be safe. And so if the child doesn't feel mentally or emotionally safe in a situation, it's going to be really difficult for them to attend, for them to be engaged, and also for them to build those skills. Because guess what? If they don't feel safe with you, it's going to be a lot harder to build up those skills in a vulnerable setting. And then the third piece that we should consider and approach is learning. So once physical safety is taken care of, and once their emotional safety is taken care of, only then are we able to start thinking about learning. So learning academics, learning new skills, learning how to regulate, all of that has to happen once they are attended to and safe in all, kind of all facets. Thank you. So we have an image on the screen, a text-based image. It just says regulation before expectation in different fonts and colors. And so this is a huge kind of motto of ours and many of our colleagues. And again, so it really just goes along with making sure that a child is regulated, safe, and able to learn before you're putting these expectations on them. And again, the expectations can be building those regulation skills in the moment. It can be math skills. It can be whatever it is that you're trying to work with them on. So again, regulation, we keep throwing this word around and we haven't really explained just yet what that looks like. So on the right side of this slide, we have just a little graphic, and it has a circular image with like an outline of a stick figure holding a heart, a little speedometer with a few emoji faces, and an outline of a human head with some gears that are spinning inside of it. So again, to emphasize that regulation is a process of all of these different factors of our body and brain. So let's see. So a great organization that has actually come here to Perkins and that we've connected with in the past, known as Autism Level Up, definitely look into them, defines regulation as the ability to manage and shift one's energy and behavior to match the demands of an environment, which is a core aspect of well-being and personhood. So sometimes we might not even notice that regulation is happening. You might be shifting in your chair. You might be planning to get dinner after this session wraps up. I don't blame you. But it's important to remember that this process gets harder when we're still learning. So for kids or for folks with neurodivergence, you might need a little more support and time to build up those skills, right? So for example, this process might be hard for some of our students, some of our children, walking into a friend's birthday party. That could be really hard for some of our kids. Some of our kids might be so psyched. They're like, give me the pizza. Other kids, that might be a lot for them, and you might need to do a lot more prep.
I'm the kid.
It's my birthday party, and this is the kid. Another example is like feeling constricted in your jacket at the end of a school day. So some of our kids, some of our students, they don't want to put their jacket on. They don't want to put their backpack on. Sure, it might be a one-time thing. They had a bad day. They're grumpy, whatever it is. For other kids, it might be the feeling of that jacket. It might be just too tight in the wrong spot that, they just can't deal with that. Even if they're calm and happy right then and there, if they've had a day, not just of sensory input stimuli, but demands, et cetera, maybe they've done great for hours and hours, and that jacket is just too much. So we really need to keep that in mind. Similar unpredicted schedule changes, so at home, at school, whatever it may be. Again, just really recognizing that these simple experiences that so many of us take for granted are really hard for some of our kids to manage and approach. So always make sure that you're meeting the child where they're at in that moment. consider them as a full human, right? So they're being affected by all sorts of internal and external factors all the time, just like you are. But meeting them where they're at doesn't mean that you're going to fix the situation or prevent them from having difficulty. It just means that you're showing them respect for their needs, for their emotions in that moment. And it's really crucial to make sure you're moving at the child's pace. So showing them that you're there to work with them rather than judging them or pushing them to work faster.
Thank you. We're talking about regulation for our students, for our kids, but one crucial piece of working on regulation with kids is our own regulation. We all experience dysregulation in our own ways, and impacted by various things, different people, different things. We can't support anyone if we dysregulated ourselves, right? I can't support my partner feeling irritated about something. If I'm irritated about the same thing, we're probably just going to get into a fight. And it's the same with kids. It's really, really hard to support kids if we are not regulated. So we have to learn to recognize and support our own needs in those moments in order to support these kids that look to us for support, regulation, and as their social emotional role models. They're learning from us. The better we get at regulating ourselves, the better we can support them in building skills, recognizing and responding to their body signals, and changing those behaviors and learning new behaviors. To do this, we have to kind of figure out our own sensory diet or toolkit of regulating activities that work for us. So for example, with my daughter, my partner and I have worked really hard to narrate what we are doing as we regulate. So it's clear to her, one, that we are taking a minute for ourselves, and two, that we also are learning and working on our big feelings. They're not going to go away. We're just learning these skills that go with it. So often I'll say, okay, hold on. I'm going to take a deep breath and count to 4. Thank you, Daniel Tiger. 1, 2, 3, 4. Are saying, I need to take a break. I know you're upset, but I will be right back. And sometimes that's really hard because it means leaving while they're upset, but it also means that I'm not going to yell. And I try not to be a yeller, but it happens sometimes. I will say, Daniel Tiger, for life. At this point now, when my kid sees me getting upset, she says, well, when I'm feeling frustrated, it always helps to take a deep breath and count to 4. Preschoolers are smarter than us sometimes. I do want to add this caveat of we really need to make sure that the child is safe before we step away. And so that can be a really tough balance of, are they physically safe? Are they going to be emotionally safe if I step away? Is there a way for me to regulate myself and monitor them, etc.? And that's really going to depend on you. It's going to depend on your child. It's going to depend on if you have somebody else in the area that can help you. I'm really big on tapping out and acknowledging when we need to step away, or sometimes tapping in and telling someone they need to step away, which is not always everybody's favorite thing, but it is what it is.
All right, so again, it's super important to make sure that you're showing up well, because a lot of times regulation skills are going to start out with using mutual and co-regulation skills, right? So that's the process where we generally start out. Sometimes we might end up building some more independence around that. There might be some things that are done for self-regulation, but that said, there are skills and activities that all of us, our kids included, us included, are doing that require co-regulation. So again, working with a partner, if you both need to just take a minute, that in itself is a co-regulation strategy, because you're kind of prompting each other in that moment. We're going to take a sec and then we'll come back to this. Again, if you're having a stressful day and a friend comes over, or a friend's talking to you on the phone, letting you vent and rant, hey, guess what? That's a co-regulation strategy. So again, there's really no better here. And there's really no one way to practice regulation. So we're going to shift through, at the bottom. So I have this little note here, just we really want to hammer in that we're going to shift between mutual and self-regulation all the time. So that said, mutual regulation is regulation that involves support from someone else. So that could be verbal support, it could be physical support, it could be emotional support, and it can vary, of course. So this might be provided to help prevent a targeted behavior from occurring or in response to a child's behaviors. So for example, if a child is going to have difficulty with that transition, maybe the adult steps in a little sooner to provide some options and provide some support prior to a bigger behavior occurring, to offer some of those choices in advance. Other times, you might not be able to, prevent it, expect it, whatever happens. And then you're just responding to those behaviors with providing that support that that child needs. On that note, adult support might be provided with or without request from that child. And so, for example, their level of need might vary, and they might be kind of in an unsafe situation where you need to step up and say like, hey, I know that you need this right now. And, they might not be able to ask for that. So always make sure that you're meeting them where they're at. If they're unsafe or really dysregulated, they might need some more of your support. They might need some time, just like Alina mentioned, to be able to process those supports. So take it slow, be patient, take a break yourself, encourage them to take a moment, validating their feelings and needs, and consider any other factors that might be important. So for example, if you're working with a child who has a history of trauma, making sure that you are working with the rest of their team so that way in your response to those behaviors, especially more challenging ones, that you're making sure that you're using any type of trauma-informed supports, for example, in that strategy. Further, so again, if a child is super dysregulated and isn't able to ask you or tell you what they need in that moment, we really need to make sure that we're following all forms of a child's communication. So some kids might communicate with speech all the time. Even in those moments, you might need to rely on their gestures. They might be pointing at something because they can't speak. They can't tell you what it is. Other children might speak sometimes verbally. They might use symbols or images. They might use an AAC device or a low-tech device or something to that effect to help them communicate their needs and opinions. So, some kids are going to be moving between that spectrum of communication skills. And we really need to make sure that whatever we're offering them in that moment, that we're offering them choices for communication, and that we're making sure that we're not asking them to perform a skill that is harder for them, right? So if making choices between two symbols is too hard for them and they don't like doing that, don't give them two symbols in that moment. If they are throwing things already, don't present them with their iPad or something that they're not going to be able to hold and access. They're probably just going to toss it. So again, really being mindful of that. And that goes back into consulting with the whole team, making sure that you're talking to their SLP and any other folks on the team like a vision specialist, et cetera, who might be able to support there. I touched on this earlier, but in order to build those co-regulation skills, you really have to have a safe and trusting relationship. So using that semi-structured approach to help build those skills and meeting the whole child where they're at, understanding them, knowing them well, that's what's going to give us success here. And again, so that might be coming from a caregiver or a teacher at a younger age, but eventually that support might come from a peer. It might come from a partner. And again, they might develop some more independent skills. So self-regulation, it's a self-guided practice of regulating. And so this is when you're going to independently access and initiate different tools, different strategies, different activities to help yourself calm down or wake up so you can focus or whatever it might be. And again, you might still benefit from supervision in this situation. So for a kiddo who jumping on a trampoline might be a great regulating activity for them. They can ask for it, they can get up by themselves, but sometimes they get a little excited. You don't want them to fall off. So still stand there, but that doesn't mean that they're not accessing that tool independently.
I wanted to add that sometimes things that look like behavior and that we think of as maladaptive are regulation strategies. And I think I have learned this from so many kids in the last few years where, like, for example, I have a student who used to run out of the classroom and we considered it bolting. And we were like, this kid is bolting, this kid is bolting. And then we realized he was going to places he felt safe. And so what we realized was he is self-regulating. We just have to find a way to make that clear to us and work on communicating to us. Or we have, we worked with a student mutually who engaged in a lot of self-stimulatory behavior. And there was question of if it was safe or not safe, if it was making things worse. And then when we stopped and watched her body language, she would go to a quiet corner of the classroom, and it was always the same corner, and she would turn her body away from us. And I think we were thinking of that at first as, this is avoidance behavior or escape behavior. And we really realized that this is self-regulation. This is truly self-led regulation. And we need to learn when we can accept that, especially if it's safe.
Exactly. So on this slide, we just have an image. It's a little graphic here. And so it's got some text that's like kind of top right. It says building self-regulation starts with co-regulation. There's a nice little image of a stair outline with some stick figures at the bottom. There's a child and a parent, and it says co-regulation with an arrow pointing up the stairs to an individual child stick figure that says self-regulation. And so, really, this is just to emphasize that most regulation will begin with support at that co-regulation approach, and then we might build up that independence. But it is a stairway, right? So there's no, you're not just always going up. Sometimes you're going down. So we're going up and down this stairway all the time with our regulation approaches. All right. So moving on to the actual functions of behavior. So first up, we will talk about internal functions of behavior, which again, those are those automatic processes that are happening to internal and external pieces, to internal pieces of our body. So we have sensory, pain, and physiological systems here. Okay, so first I'm gonna go into just some sensory information. So a lot of the times as an occupational therapist, I end up working on the team to help support children in learning sensory supports that help them to regulate, that they enjoy, et cetera. And so, a big part of that is assessing the sensory systems and seeing what's working, what's maybe, a little off, what we need a little more of, what we need a little less of. So there are 8 different sensory systems. Some of them are ones that everybody, goes to and knows. So we've got touch, we've got sound, we've got taste, we've got smell. Of course, we've got vision. And so for a lot of our, kiddos who have vision impairments, this is going to be extra crucial to pay attention to, because having a decrease in vision or no vision is going to impact their ability to perceive and integrate other sensory inputs. That's not to say that every kid with a vision impairment has significant sensory processing needs. It's just that they might need a little more movement. They might need a little more pressure just to keep their body awareness up. Let's see. So that pressure and input to your joints and muscles is proprioceptive input. Vestibular input is the term for movement-based sensory input. And then our last one is interoceptive input. And so that is what's happening kind of inside of our bodies at any time. So that's what is sensing that we're hungry, what is sensing that's what's going on with our blood flow, et cetera, et cetera. And so these systems are all working together in the brain to make sure that they understand and can respond to sensory input with all of these internal and external behaviors. So any differences, again, are going to change up the way that they need to stay regulated. So some kids might seek additional input to help them maintain their arousal levels. And so arousal levels, it's kind of like how alert, how calm, how focused you might be. Some kids might avoid certain inputs that are uncomfortable or otherwise upsetting. So this is where that I just want to touch on the fact that the internal and external factors kind of get a little murky when it comes to some sensory stuff, because while, traditionally an internal function of behavior happens in the absence of environmental stimuli and input, the exception there could be that, bright lights or big sounds and things like that, that are kind of physical environmental aspects that might impact that child's sensory processing. Those things might kind of have that interplay there. But it is a little different. So it's kind of just blurry again, whole team approach. And then some kids might engage in self-stimulating behaviors. This is often referred to as stimming, and I'll get into it a little bit later, but often it's something that you want to encourage for these kiddos. Next up, there's an image on this page that says, why is sensory regulation important? The image is of a stack of stacked rectangles that demonstrate the way that that regulation skills build up from a foundation of sensory regulation, which is the bottom brick on the tower. So support your child's stims. Stimming can be a huge, excellent tool for self-regulation for many individuals with sensory needs. So autistic folks, kids with sensory processing needs, kids with vision impairments, honestly, just like anyone. Anyone, everybody stims, like you don't even know it. Some are just bigger than others. That said, we want to make sure that it's safe, right? So we want to make sure that the child is safe. They're not harming themselves physically. They're not putting themselves in a situation that might make them unsafe. They're not, bolting out of the building entirely into a parking lot. They're bolting into a quiet, small classroom, right? So those are different things. And so again, as long as it's safe, we want to make sure that we embrace these actions and that we encourage our kiddos to find safe and fun ways that they like to regulate themselves. Some key things to keep in mind as we're exploring sensory needs. Provide some opportunities for your kiddo to explore different sensory supports. So this can help them build a toolbox of those preferred activities over time. And then helping them to build up like a language that can describe how they're feeling, what their body and brain might need, and what they can do to calm down, to focus, or just to feel better. And then finally, we can provide education and guidance to them. This is the way that we help them to feel safer, that we validate how they're feeling, and that we help them to understand what it might be that's making them feel that way, both physically, emotionally, whatever it might be. So on this slide, I just go into a few different examples of types of sensory input that can have different impacts and can be helpful. So we've got, generally there's alerting activities and calming activities are some of the phrasing that we might use as OTs. You might hear of like red zones, yellow zones, all sorts of things. That said, in this setting at Perkins, I have always tried to avoid using too much color and vision-based like explanation and strategy around self-regulation. In public schools or with kids who don't have a vision impairment, that can be super useful and helpful. But for our kids who might be tactile learners or might need a little more support, we often will adapt the terminology, we'll adapt the materials, et cetera, to suit that. So just a quick note there. But that said, once we have that access method understood, we can start to provide these activity choices for our kiddos. So for some alerting activities, you might want to do some quick movements. That could be swinging, dancing, etc. Something else that can be alerting is stretching and yoga. So sounds a little contradictory. I feel like we usually think of yoga as just being super calming. And that is true. It can also be used to calm down for some of our kiddos too. But the stretching piece and the movement piece of the yoga is really what can help to build up that alertness. And that's because it's helping their brain and body be better mapped together. So if you think about it, it's like, okay, now I can sit up taller in my chair because I just did these yoga poses. Upbeat music, a busy environment can be alerting. And then even different foods. So spicy foods, sour foods, cold foods, like an ice cold tart smoothie, that can be super alerting for any of us, but especially for a kid with some of these sensory needs. Some calming activities, slow rhythmic movement, using a rocking chair, for example, but just making sure that it's going kind of constant in one direction. Massage and joint compressions to elbows and wrists, et cetera. Make sure that with that kind of stuff, you are reviewing it with the occupational therapist on the team just to make sure your pressure and location is correct. But that can be super calming. And oral input. So other types of oral input that can be calming. There are some flavors, that are a little more like relaxing and things like that, that for a kid who gets really overstimulated, you might want to stick to. But other stuff like thumb sucking or using a pacifier, those things are kind of those inherent, almost like internal automatic self-regulation behaviors that it's kind of a unique area where the kiddo starts out right away self-regulating if they are a thumb sucker or whatever it might be. So making sure that we keep in mind that children are always going to be different from each other and even from themselves day to day. Always consult with the OT on the team, always consult with the whole team. That's super crucial. So we're looking at communication, movement, vision. All of this is integrated. All of it is working together. Sensory related behaviors should always be factored in when you're determining intervention plans for behavior and for everything else across the board.
So for automatic, physiological, or pain related behaviors. I think it's really important to note that not everybody realizes it's not uncommon for kids with neurodivergences, with multiple disabilities, who are more complex medically, et cetera, to experience and respond to pain differently than we might expect or than neurotypical people might expect. Pain often involves the internal release of chemicals and registration in the pain-related pathways in the brain, but how we respond to that, it can be very different. Behavior might be an attempt to divert attention from pain. So maybe if we have a headache, we might see a child hitting their head or seeking pressure. I've seen this a lot with ear infections too, where we're like, why is that they're hitting their left ear more than their right ear today, or they're rubbing their ear a lot, those kind of things. Generally, when these things happen, we really prioritize safety and meeting those needs first. And recognizing that those behaviors might be related to pain can be really helpful in determining, what do we prioritize with communication? Do we need maybe a medication specific plan of like when we see X behaviors, we give Tylenol, things like that. And really working on finding ways to communicate that pain and find safer alternatives to managing that discomfort. It might even just involve movement or changing in physical input. So if somebody has a lot of GI discomfort or cramps or things like that, we might really promote moving the way that you're sitting with your body to help relieve that pain or make it at least a little bit less intense. Not more intense. That's not what I meant. Behavior might also occur for other physiological related reasons. These might be related to interoception, like Molly mentioned. So hunger, fatigue, a change in heart rate, discomfort related to the temperature is another big one, especially when it starts to be going from one temperature outside to another temperature inside. Or we have a lot, we might have some hot buildings or some cold buildings. I lost my place and that's okay. I'm thinking, sensory input and then just medication changes in general. I like to remind people that when we're looking at, daily medications, a lot of medication trials are completed on very specific populations of individuals. And so we might see side effects we don't expect. We might see responses we don't expect. And we might see behaviors related to kids not understanding why all of a sudden they feel differently. And I think that's a really big piece to recognize. I try to emphasize with that if you're seeing changes and it's not an unsafe thing, some medications take time to settle in. And that's why it's so important to, if you have a child going to a school, a daycare center, a preschool, et cetera, keep in touch with the professionals there. If you're a professional, keeping in touch with the family when you know of a medication change, and really looping in pediatricians, neurologists, et cetera. Especially because they'll know how long those meds take to settle in or how long it might take to see changes. Loop. So external functions of behavior. So we're going to dive into what does it really mean? Attention maintained behaviors. Like people say that and it's like, what do you mean? We think we know what it means. Spoiler, we don't. Escape and tangible. So for attention can mean a few different things. It could mean I need or I want comfort, especially for younger kids and their parents and other adults that they trust. If we see a change in behavior as it relates to comfort, when we have younger kids come to visit, maybe to consider preschool, we'll see this a lot with parent separation. Can mean I want connection. This can mean I want to play with you. I want to snuggle with you. I want to watch something with you. I want to show you something. I just want to be with you. And then it could mean your attention is divided and I want to show or tell you something. This is kind of that classic example of the kid has been leaving me alone all day until I'm on the phone with someone. And then all of a sudden they need me. That's kind of an example of that. Or we'll see it sometimes with kids who are very used to one-on-one attention and the adult that they're with turns to talk to somebody else. And we might see either a silly behavior, a frustrated behavior, or something like that. So what are the strategies? What do we do if it's one of these? So for all the time strategies, provide what's called non-contingent attention frequently, especially for younger kids who are learning to operate independently without constant attention. As somebody who has a single child who not that long ago had a baby, we give our kids so much attention. We are so excited to have them. And then they become 3 and 4 years old and they learn to communicate with you one way or another, and they want that attention on their terms all the time. So by giving non-contingent attention when you're able to, without expecting anything in return, it's easier to then teach them, looks like you want my attention. You can tap me on the shoulder. You can press I need attention on your device, etc. If there are times when attention won't be available, enrich the environment. Provide those highly preferred activities, especially if that child tends to get upset when attention's not available. Find other ways to help them to get used to not having that attention. For some of us, this might be controversial. For some of us, this means tablet time. For others, it means you can have that toy that makes obnoxious noises all the time, and I'll wear noise canceling headphones while I'm cooking, right? So things like that. That's also really great for practicing independent leisure. Which leads to practice those independent activities. Use attention as a motivator for learning new things that they will then eventually be able to do independently. This could mean, say, you're working on your laptop, and they have a laptop looking toy and you're parallel playing and they're learning to do that independently. The more independent activities that are available, the less likely that child will become bored and seek out that attention when it's not available. So what about when behavior is happening? This is the time when you absolutely know co-regulation is key. If I want attention, self-regulation is not going to do anything because that means that I'm still by myself. If a child is reacting to those big feelings because they want comfort, regulating with them is going to be the most emotionally safe option for them. It's not bad to want attention. It can be exhausting for us. It can feel bad for us sometimes. It can make us feel like bad parents or caregivers when we're not able to give it. But it really is just about learning and developing and practicing. Once they're calm and safe, remind them of those different ways to get attention in the future, or remind them of what's available to them. External functions. Escape. Escape is another one that people tend to boil down to. They want to get out of this, and that's not a good thing. What it could mean, I'm overstimulated. I need to escape from lights, sounds, crowds. I'm going to start talking a little bit faster because we're running out of time. That's escape maintained. Maybe, I don't know. Escape from school tasks or activities. It could mean that's too hard. That's too easy. That's unfamiliar. I don't want to try something new today. I'm not feeling it. It could mean escape from less familiar places or people. I don't know what to expect here. Even if you're a new person doing the same math activity I do every day, you are probably going to hold something different or say something different. I might be seeing different colors out of the side of my eye if I don't have the best vision, and I really rely on that to recognize who's around me. It could mean I don't feel well. This is when that physiological piece goes hand in hand. If I don't feel great, I am way more likely to want to get out of doing stuff, right? If I have a headache, I don't want to go to work. I'm going to have a harder time focusing and engaging, socializing, etc. So, time strategies, incorporate assent when possible. Assent is just a fancy, more accurate word of saying consent based on body language, kind of, making sure that they're interested, they're happy, they're engaged somehow. Offering and teaching to request frequent breaks. The more that a child understands that you're going to respect their request for a break, the more likely they are to engage in things because they'll know that's an option. Preview if things are new and uncomfortable. Pair new activities with familiar people or familiar activities with new people. And add new things among familiar demands. So if you're doing a new math activity and you're asking somebody to sort silverware instead of coins, maybe do a little bit of both. In the moment, reduce stimulation and address what might be causing distress or discomfort. We very often start talking more when somebody's upset. Which is kind of the opposite of what you should be doing, because that can be very overwhelming and can create like demand fatigue. So by reducing stimulation, by reducing maybe the lights, the sound, the people that are around, that can be really helpful. Provide a safe break space. That's going to look different for every kid, and meet them where they're at. If it's possible to reduce or remove the demands until they are calm and safe and maybe ready to try again, or you know what, this was hard, we'll try this again later, and that's okay. Tangible, what can it mean? It basically means I want what I want, right? I want what was taken away. I need that specific thing. And it's really, really important to recognize that what we consider a need and what a child consider a need are not necessarily the same thing, especially because rationale, like kids are black and white thinkers. Kids don't think in terms of gray and shades and all of this. It's like, I need that, I need it now, I need it the way I want it, etc. What are some strategies? Scheduled or routine times for things that we have a hard time giving up or that we want all the time. Teaching that communication around asking for what we want and need. And then when somebody asks for something, reminding them more specifically when it will be available, especially because of that black and white thinking. If you're just like, nope, that's not available, in my brain, I'm like, I can never have it again. And I'm going to have a big meltdown over it, right? But if you're like, that's not available right now, you actually get that after dinner. Okay, I know I'm getting it and I know when. In the moment, the real big one for this is this power struggle worth it, right? Is this a boundary that I've already set and that what I was clear about previewing? Is it safe to maintain this boundary? Why is this not available? Am I just doing this because I'm the adult and I'm in charge and I said so? Or is there like a real reason this is not available?
All right. So we promised that we would loop emotions into this a little bit more. And while we did touch on it as far as internal functions of behavior go and kind of the interplay there, we have to really work to make sure that we're helping our students and kiddos understand how they're feeling and what that means for their body and for their behaviors. So in helping a child to learn about their emotions, make sure that you're avoiding specific labeling of those emotions, especially when it's a bigger emotion that may be causing some of those behaviors. So rather than telling a child how they're feeling based on your perceptions, again, we might not agree with what needs are, et cetera, give them some more autonomy in choosing to describe how they feel. So instead of saying, hey, you're feeling mad, you could say, hey, I hear that you're yelling. Your face is getting red. It seems like maybe you're angry or frustrated. Let's take some deep breaths and talk. Or again, maybe you or they are not ready yet. So you can say, hey, let's take a minute of quiet, or I'm going to step away and we'll talk when we're ready. Again, safety first, but that's a good way to approach that situation. That said, the concept of readiness for a lot of these kiddos is going to also be its whole other thing. That's a whole other presentation. But just know that the idea of when you're ready might not be something that's accessible for all kiddos. So again, just making sure that you are working with supports and terminology and skills that that child is ready to use. Our role is to help the child learn language about how their body is feeling, help them to understand the types of emotions that they might be experiencing and where that might have come from. So any triggers or any experiences and needs that make them feel certain ways. And then finally, helping them to understand what they need to manage that feeling in that moment and to prevent a bigger behavior from happening. This is that emotional intelligence that helps them to learn and access those tools so that way they can cope with their feelings and behave safely. And remember, these regulation needs are going to vary and they will be multifaceted. So as adults, make sure that we're looking at the whole child, take emotions into account, and make sure that we're using all of that together when we determine our behavior strategies. One other note here that I really want to emphasize is that emotional regulation can definitely help to prevent and modify some of these behaviors. But that said, that emotional intelligence and emotional regulation piece is not going to prevent and eliminate every behavior in every instance. So again, whole team approach, keep this in mind. It will be trial and error and not everything will work every time. Got an image description for here. So we have a woman on the right side, kind of just a sketched figure holding some colorful balloons with different faces on them, just kind of representing how big our emotions can get. So there are so many different terms for emotions that we feel that we don't even think about. There are at least 10 different ways that you can say that you're feeling happy, you're feeling joy, you're feeling happiness, gratitude, etc. So again, this can be really hard to wrap our heads around as adults, let alone as kids. And they can all impact our bodies in very different ways. So it might lead us to feeling lower energy or higher energy, and that's where some of those calming and alerting strategies might come into play. But it's really important to remember for ourselves and for our kiddos that no emotions are good or bad. So another kind of beef that I have with like the zones and all of the colors is that for some, it kind of emphasizes or instructs that some emotions are red, they're bad, they're scary. Some emotions are blue, like, oh, you're really lazy, you're really tired. That might not be true. It might be great to be in the blue zone if it's 11 o'clock at night on a work night and you need to go to bed because you have a presentation the next day, right? It's okay to feel blue. It's good. Sometimes it's okay to feel red. God forbid you get into a car accident or something like that. You're going to feel upset in those unsafe situations, and that's appropriate. So really, when we're teaching our kids about these big emotions and how they're feeling, is to not just give them that language, but to validate that all things are going to be okay. It's just a matter of the situation, like the matchup there, and how they're responding. So on that note, if these big emotions are building up over time because they don't know how to manage it, that could result in even bigger behaviors, even for triggers or situations that are typically more minor. And again, these can really be tied to some of those automatic behavior responses. So crying, laughing, different changes in the body, our posture, and other behavioral responses can be initiated by an emotion, can be initiated by a behavior and emotion, or they can be the driving force behind that behavior or behind an emotion. So it's really important to kind of just understand how big and integrated they all are. And again, hammering it home, we cannot control emotions, ours or our child's. All we can do is make sure that they understand how they can regulate safely, and making sure that they understand themselves as best as possible. But why is that important?
Because we want to build independence and self-advocacy. So building mutual and self-regulation skills, understanding triggers, addressing physiological factors, etc., helps modify behaviors, right? Having a better understanding helps develop autonomy and self-advocacy. And when we do that, we can figure out what works. We can advocate for those supports in various environments for our kids and teach them to advocate for themselves. We can include these in 504s, IEPs, behavior, sensory communication plans, and in those guiding interventions. And as children learn more about their emotions and their needs, we can support them in using that total communication approach to express themselves and seek regulation tools with or without assistance. Looking ahead, we're going to just keep hammer it home, meet that child where they're at, follow their lead. It's important to practice and reinforce related skills. Consistency in response, such as our language, our approach, and access to those tools is crucial. It's really about a scaffolded approach, which is essentially building little by little on skills to build up those regulation skills, guide exploration, and expand the repertoire of tools. If our goal is behavior change, this is how we do it. We learn about their needs, we access and implement strategies, and we build independence, autonomy, and self-advocacy. What about us as caregivers? So, what are our next steps? I'm a huge advocate for continuing to learn. I don't think there is such thing as knowing too much. So explore resources, connect with agencies, families, etc., that can be a supporting resource for you. Make sure to share the specifics for your child with their team and promote that collaboration among team members, whether it be through early intervention teams, IEP or 504 teams, outside therapists, etc. Pay attention to what works for your child and create consistency around those strategies. This might take some trial and error, but helping find consistent ways to make their lives and yours feel comfortable, safe, and promote skill building and regulation will help you all. Remember that behavior may change over time, especially since kids age, environments change, growth continues, God forbid everybody hits puberty, etc. It makes sense for your strategies to evolve too. Right? So I say consistency, and then I say, guess what? Consistency is great, but things are going to change too. as a parent, for those of you in the room, know your child best, and you're always going to be their biggest advocate. Some helpful resources. Autism Level Up, we've talked about a ton. It is made by an autistic PhD and ADHD OT. It is not just for autism. I use this with a lot of kids. It really talks about understanding your energy levels, what supports you need. It's phenomenal. I'm obsessed. Anything by Dr. Ross Green, fantastic. And similar to Dan Siegel, he writes No Drama Discipline, The Whole Brain Child, and a few other things. Also really great resources.
All right, so that wraps up the bulk of our presentation. So we are available just to do a little Q&A. Just some little kind of guidelines here since we are hybrid. We are going to take in-person questions first using the microphone, passing it around the room. And if you are attending via Zoom, you can you can put your questions into the Q&A. So if you're in person, please raise your hand. We'll come around with a microphone so everyone can hear. And if not, then you can put your questions in the Q&A on the chat and we will read them later. And if we have anything left over, we can either hang out at the end or you can reach out.
What's the difference from traditional ABA?
That is a really great question I could do a whole presentation on that. So traditional ABA utilizes what people consider behavior principles, such as reinforcement, et cetera. And historically, I'm trying to think of how to say this nicely. I hate to say it, but I kind of compare it to animal training. It's like, do this, then you get that. It really focuses on extrinsic motivators. You get to access this thing rather than intrinsic. A lot of us are not taught how to consider the internal and emotional factors, and we're really just taught behavior change. And a lot of the research shows that even though studies might show progress in the short term, there's not a lot of long-term validity. Neurodiversity affirming ABA as it should be. There are people who say they're doing neurodiversity affirming. It's better, but it's not fantastic. People who are truly doing neurodiversity affirming ABA are really looking at those regulation, the advocacy, the self-regulation about kids being able to be kids and adults being able to be themselves in a way that allows them to exist happily, comfortably, etc., regardless of what society says is normal and regardless of what society says is typical. So you should be able to stim. You should be able to love Barney if you are 30 years old, and that's okay, as opposed to you have to make eye contact. You have to interact this way. You have to learn these skills. That's my short answer.
From the OT perspective, I have just one little thing to add here. So like an example of that withholding piece that can happen in less neurodivergent affirming practice for ABA would be, for example, I've had kiddos who use noise canceling or noise limiting headphones for transitions for certain settings. And I've seen situations where their behavior plan has instructed staff to remove the headphones from them if they are exhibiting certain behaviors. As that student's OT, I stepped in, I consulted, I advised that we really shouldn't be doing that because what I noticed and what will happen in a lot of those situations is that those behaviors will become more pronounced because those headphones, that sensory support shouldn't be given as like a reward. It's not something to take away in the presence of behaviors. It's really, if it's not working in that moment and they're still having behaviors, like that's not going to fix it if they need that. So really considering that person's needs and not trying to modify them.
If you can, I have a student who we're working really hard on big emotions and big reactions to things. And we use a lot of like, take a break or describing language. I'm seeing you're getting frustrated. Let's take a break, but we're really, we don't want to hear that and we want to keep doing the activity. So how do you teach taking a break? Because then if I remove the activity, we also end up in big behaviors because we didn't want to be done.
totally. So I can start, and then if you want to add anything. So for me, absolutely. I have plenty of students in mind who I can relate to that on. So Alina had mentioned taking time during these kind of unexpected moments to praise certain behaviors, right? So, oh, it looks like you're so ready. It looks like you're so ready for this activity. When the child is just, sitting there happy, collected, whatever, reinforcing and labeling that, but also again, similar to emotions, describing what it looks like that they're ready. Oh, wow, your feet are on the floor and you are sitting in your chair. You look comfortable. You're looking at your desk. Your voice is, whatever. Something like that. And so describing it in those moments of calm and happy. And then in those moments that are harder, as you're working on building the understanding of what they are or how ready feels and what it is, it's a lot of modeling. It's a lot of patience. It's a lot of, again, taking a step back yourself. That might be like just creating a silent, quiet environment for the child, depending on their reaction and behavior. It might be just sitting and taking deep breaths yourself, sitting at the table with them. I know for myself, I will often sit there and I will say, taking deep breaths makes me feel so calm right now. I feel so relaxed. I think I'm ready for whatever. And I kind of just model and narrate what I'm doing. I narrate how I'm feeling and presenting. And they may be able to acknowledge that and hear that. Sometimes they imitate, sometimes they don't. But again, just really kind of getting there slowly. And one note, as far as I meant to say this during the presentation, if you're prompting for like deep breaths and things like that, that's a big thing that I find to be more helpful if you're modeling it really heavily. And another term that I've started using instead of deep breaths with my students, especially kids who are autistic or have some like motor difficulties, I say slow breaths because that seems to be a little easier for them to understand. Like at the very least, they're blowing out slowly, not right. So it's, yeah, exactly. So so just that's another little note.
So a couple of things about this, because I also have kids who are like, I want to do this thing, but this thing is frustrating me at the same time. So this is assuming that there is no self-injury, because self-injury changes everything and is not something that I can recommend or give recommendations about without knowing more about a child. But one thing that I often will do is wait until, so I don't talk over students. It just amps and amps and amps. So usually when a child is making a lot of noise, vocal, yelling, etc., is when I am just taking deep breaths. There is science that shows that just taking deep breaths near or with young children actually helps them regulate their own systems. The middle of the night that I learned that was a game changer with when she was 2 years old. I was like, all I have to do is breathe and you'll stop crying. All right, I can do that. So that's a big piece of it. I use a lot of language of like, this is really frustrating and that's okay. I think we're going to take a step back and we can try again later. And that might result in a bigger feeling, but it's learning our big feelings are okay and we're going to get it back. And that is, I think, the biggest piece is try, like, you know what, this is making us frustrated. Let's try this other thing that we're not going to get frustrated with. That kind of thing.
Great, thank you.
But we'll take one more question, and I would just encourage people to use the Q&A if you have further questions, and you can also follow up on the conference. I think our sign language interpreters are probably going to have the
Cool. This is sort of related to the last question, but how would you approach a child who kind of just has one thing that they sort of are looping on and obsessively wanting to do, and they will do it ad nauseum, and it's interfering with other parts of their life and kind of moving through the day. Just, obviously wanting to honor the sort of stimming impulse. So in this case, it's like opening and closing doors just constantly. And, we'll do this for hours and hours if they can. And I'm just curious kind of how you would approach that from honoring where it's coming from, but also needing to have other elements in their life.
Absolutely. Great question. It would definitely be more of a package than like a single thing, right? So number one, if you have choice time, when I try to think less about like, do this and you earn that, and more in the naturalistic, like in high school, if I finished my work early, I got to like do this, that, or the other. I got to listen to my music, right? So like, that's kind of what I try to think of. Same with like, if you finish this center in preschool, you get to free play, whatever. So making that a choice during choice time, free play, etc. Sometimes that might mean having shorter demands as you're adjusting to, I have to do this to get that. For some kids, I'll use a lot of either first then boards or now next, depending on if the kid has a history of first then means first I do this, then I earn that. I try to use now next instead, because it's not something that's often used. And then I also will try to find something that can simulate that to have in the workspace or in another environment. So maybe that's, and this is really dependent on what kind of input kids are getting, and that can be really hard to figure out. So maybe it's you get a little like wardrobe, like an American Doll wardrobe, and that they can have that while they're working, and you can redirect a little bit, and they know that's right there, because that's a big trust thing. That's a big, I know I can have this thing, especially if kids are used to their things being hidden or removed, which we think is really helpful, but a lot of times builds kind of trauma responses and trust responses. So that's kind of the big is like find a way to make that an option, or schedule it in if they have a one-on-one para and it's an option for them to go do that during recess, especially on a rainy day, then do that. If they as they develop new interests, possibly some kids do, some kids really just love the sound of lawnmowers for their entire life. And that's a lot. There are a lot of lawnmower sound YouTube videos in case anybody was wondering. They love opening and closing cabinets their whole life. And then it really becomes teaching boundaries and expectations, which is where some of those resources about kind of how do we walk kids through big feelings about boundaries, because I think that's something that when we look at like gentle parenting and gentle teaching is very confusing, is like, do we give this kid everything so they're always happy? No, we teach them what boundaries are. And there are ways to do that and scaffold that for kids. Did you have more to add?
Yeah, just one little thing. So one thing that I've tried to do, not quite in that situation, but incorporating or changing up the activity a little. So I've had a student in the past who loved sorting specific items relevant to her schedule. And so started mixing that up a little bit. So having her, pick them up out of the container and start sorting them herself. Like if she's like going really fast, she wants me to pull it out too fast, to kind of to change it up a little bit, make it a little harder, make it a little different for her. And then again, in a situation like that with like a door or a student who may be spending a lot of time just sitting on the ground or whatever it is, I've done a lot of just bringing their work to them. So depending on the kid, and it doesn't have to be super structured. It can be that you're standing there and you're just talking about what they would be learning in class otherwise. I'll sit there and I'll just talk about the feeling of the ground. Oh, that's really smooth. Oh, wow, we're on the grass. Oh, wow. Did you know that dirt's under there? And I start building in their academics and their learning into that activity. So if there is a form of escape or whatever it might be, that they're also starting to learn, okay, like Alina said, those boundaries and expectations around it. All right, I'm going to play with doors the rest of my life, but I guess I'm going to have to do some work while I do it, So
Thank you.
thank you, everybody. Definitely just send in any of those other questions into the Q&A or on the app. And I guess we'll hang out for just a couple of minutes if anybody has any other questions. But thank you.